want to talk about today? What do you think? I like how we're matching. We have like blue and blue. It's really great.
Mine's purple.
Showing blue on my screen. That's okay.
Is it?
Okay, so what do we want to talk about?
Well, I'm interested in what it is that you do that I guess is different, and how are you going to help people who are really struggling with major mood disorders?
Okay, so when you say that's different, what do you mean that's different?
So when a patient comes to see me, they have complaints, multiples of them. Their mood is bad. They're failing in areas of their life. They're despairing and distraught. They have no energy. And so I'll maybe do a Hamilton depression inventory if I'm thinking depression.
What's a Hamilton depression inventory?
A Hamilton depression inventory is a series of questions. There are several that I use. PHQ-9. I was going to send them to you actually to see if you wanted to incorporate that into your cohort. Have people that are depressed or anxious. There are different anxiety inventories as well, for self-assessment and monitoring of change.
Mm-hmm. Mm-hmm.
And it could be honestly a publishable article, because these inventories are so well reviewed and documented, and all the stuff that they need, the bells and whistles, to be, in a publication.
Mm-hmm. Mm-hmm. So your question is, what would I do that's different?
Yes. So my tactic would be to discuss the history of depression, discuss their family history, look for contributions from the genetic world, from the event world. The stress diathesis model is what I typically follow. So having a genetic predisposition for an illness, having those environmental factors that make you vulnerable to the illness, and then the straw that broke the camel's back. Something happened that allowed, the perfect storm and all of these things to coalesce and meet, and the individual becomes clinically depressed. So then I further question to try to select a medication, an allopathic antidepressant, based on other symptoms the patient may or may not be having, based on their age, other issues, and I choose one, and I'll choose an antidepressant of some sorts, maybe an SSRI, maybe an SNRI, maybe something entirely different, more dopaminergic, depending on their profile. So that's what I have do and have done, and I want to do something different, and I want to see what you do.
What I do? Okay, so we look at the same things from the get-go. So we look at what is the genetic expression of the body, what is the circumstantial happenings that occur, that it might be trauma, it could be abuse, it's something. And then there's usually, yes, I agree, something happens that will push someone over the edge to having whatever their diagnosis is. Now, with my perspective, what it is that our bodies were perfectly and beautifully made. Our bodies are all incredibly perfect. They're beautiful, and we have been given on this earth plants and animals. It's even in the Bible. It tells us that plants were given for you, the animals were given for you, and so when we look at what we're putting in our bodies, it's messing us up. And I would say 99.9% of people have forgotten how to actually eat and what food actually is, because just slowly over time, little by little, to make farming easier, to make food more accessible, corners have been cut. And what we're seeing now is cutting those corners affects the chemistry of our body and just messes us up. So for example, one of my favorite examples right now is bread, because so many people are gluten intolerant or gluten allergic to gluten. And then I was looking at it and I'm like, wow, because like I have this craving for bread. I always have, but I gave it up. You know, I was like, I'm not doing that because it's making me sick. Well, as I looked into it, the in the 1940s, brewer's yeast or yeast was introduced, which speeds up the whole process of making bread, which is a beautiful thing, right? Because like you can make bread fairly quickly. Otherwise, you have to do this whole fermentation process, and you have it takes hours to make your bread. What I have just learned, I didn't discover it, what I have learned is that with the brewer's yeast, it creates sugar in your body. And this is all coming, it's all going to come full circle. It creates a sugar in your body. It creates a sugar, it creates an alcohol in your body. So that's going to contribute to diabetes, inflammation, sugar, right? Sugar creates all that. Alcohol creates all that. When you do the old-fashioned method of making bread, which is now called sourdough, that, yeah, real sourdough, mind you, that method, it will create lactic acid in your body. And lactic acid actually will create a response in the body that balances the alkaline acid balance in the body. It creates a balance in there, and that makes it unfriendly to one of the most common, it's becoming more and more common, to cancer. It will actually, if you don't have enough of this lactic acid, you are likely to have, I won't say you're likely to have, you're setting a stage for that. And we all know cancer is more and more common. When did it really start becoming common? Right? It was after the 40s. Like a lot of that. So that is just one little example of the problems that we have with our food that's just kind of crept in that we didn't really pay attention to. Like, we're not looking at the chemistry of food when that all happened. We're looking at what's convenient and easy. So it's not like it's your fault or my fault or big business's fault. It's just a convenience thing, right? Like, we're busy. And so the point of that is, one of the main things that I do is look at what is your diet, because the more off your diet is, the more you're going to have a genetic expression that's disease oriented. So when we look at the genetic expression of the body, we can actually stop that train from going down the path of disease, and we can put a stop to it, and sometimes even reverse that, simply by giving the body what it actually needs to, as an organism on this earth, to operate. And you can't run from a bad diet. You can't hide from a bad diet. Your body remembers everything. And one of the main things that I work with people on is their diet. Now, for depression and anxiety, a lot of times they're not getting enough protein in their body, in their diet. And then there's the digesting of protein, which lactic acid actually helps you digest protein. And so you have this mechanism happening in this diet that has just emerged over time, where we can eat all the right things, but we're not eating the right things because it's hard to find the right things. It's really hard to find the right things that will actually help your body function and help all your organs function. And so what I do with people is I go back to, let's eat right. Let's get that changed around. There's the spiritual health of it as well. Are you the self-talk, the being in environments that are unhealthy for you? Ironically, if your diet's really bad, it's really hard to change your self-talk because the chemistry creates all this agitation in you. Like, you're agitated from all the chemicals, and your body's just like, I need to get this out of me. Like, I'm trying really hard to keep you alive and I can't. I'm working on it. And then we say, I hate you. Like we tell our bodies, like, I hate you. God, I hate my body. I hate, like, and it's like your body's doing everything it can to help you walk through this life. So give it a little love, give it a break. Like it's doing its best because we're just feeding it junk all the time.
Yes.
I would say that for people who, the further down you are on the path of needing medication in order to function in life, the longer it takes and the longer the journey is to turn that around. Because if you have had such a diet and such a lifestyle that feeds into the disease, your genetic disease process, it's a learning process to turn that around. And so changing your diet is the first step. I also do supplementation for feeding the organs because they're starved. One example is kidneys. Like a lot of people can't drink a lot of water, and our kidneys are, in my world, our kidneys are dried up. They might not be medically dried up where you like look at them under
They're desiccated, yes.
Desiccated, right? Like they're not dried up like that. They're just like, I think of it like a sponge that's been squeezed out and dried. And then, you know, when you have a sponge and you try to put water on it, the water just goes, it just goes out over. That's most of our kidneys. And so kidney support to just start drinking the water to flush out the body. And then you look at like what's in your water. So there's a lot. There's lots of toxins in water. So if you're drinking tap water, you've got toxins in your water, and that toxins are making you sick. So there's just so many levels to it. And basically what we do is we clean up the diet, we clean up the environment, we clean up the thoughts and where your heart is. And so when I work with somebody personally, I basically hold their hand and walk them through this process, which can take 1 to 3 years. I only take a handful of patients on personally because it is a comprehensive program, and I usually help the sickest people to restore their health. And they're often the ones who are the most motivated, who are like, I am done with this. I want to get better.
Yeah.
You do as much is so important because most people don't have access to the information that I have, which is why I created a course for it. But it's just not out there. It's just not available to most people.
Okay.
Because I would say like the medical system would not consider it scientifically, whatever they would say. Like they'd say, show me, like, we can't back this up. Like in medicine right now, they're saying that red meat is bad for you. And I would agree with that most red meat is bad for you because it's grain fed, and that feeds the inflammation and disease process in your body. But if you get grass fed meat, that is not grain fed, and that does the opposite. It's anti-inflammatory to most people's bodies. So there's a lot of information that isn't full or complete that's mainstream and commonly accepted that is actually keeping people sick. And yeah, there you go.
Well, that is a comprehensive plan, really. I mean,
yeah, I know. It's a lot.
it is a lot. It's a lot. It sounds daunting, and
yeah,
and
it
is.
To
a depressed person just to take the medicine I prescribe, which, you know, I tell them, you know, I just take this. It might take 6 weeks, but you'll feel better. That's hard. So getting a depressed person motivated to undertake this, I guess they'd have to be really despairing and hopeless.
They'd have to be where most of the time, when I'm working with people who are on the psychotropic medications, whatever they are, you stay on the medication and you start feeling better, and then you start changing your diet.
Okay, that was going to be my next question. If I were to refer some of my most hopeless people to you, would I take them off of the medication initially before I visited?
Not.
No,
that would be dangerous to their health. I would say that would be no, absolutely not. And so it's getting their diet in order, and then I would work with you to determine how to wean them off. And frankly, when they're exposed to a toxin or a major stress, a lot of times they'll need to keep that medication there so that they can go back on that. So I saw people who the COVID vaccine was very challenging on some people's bodies. And even though they had gotten off, this was the most common thing I saw right after the first COVID vaccine. As soon as they got the vaccine, their depressive symptoms spiked and they needed to get back on the medication. So even though we had weaned them off, that was enough of a toxin to the body that the body went into that survival mode again, and they needed to go back on the medication for a time. The other thing that I see is with so like anything where you get a chemical, which is an unnatural substance, when you're exposed to that, like so you could even be cleaning your bathroom with a bunch of Clorox and have a similar response in the body where you're like, wow, I'm depressed. Why am I depressed? Well, your body was just exposed to a bunch of toxins. So it really doesn't have the energy to work on your brain right now. It's trying to save your life by focusing all its life force on getting those toxins out, because your body only has so much life force and some of it's going to go towards protecting you by getting the toxins out. So that's where we're having all those health issues today. But the other one is life events. So if somebody in your life has a stroke or gets sick all of a sudden and something really bad happens, even though you've helped heal yourself with food and nutrition, if you are less than 5 years into your healing journey, you might need to go back on your medication. So somewhere around the 5 to 7 year mark is when the body starts really clicking in. So I've been at this for over 20 years and my body is like a machine. It's a beautiful machine that's just like, I give it the best that I can. I'd say I do the 95-5 rule, where I do 95%, put myself in an environment of love and appreciation, the foods that I eat, and 5% of the time I'm like, okay, like I'm cheating. And my cheats would be nobody else's cheats. They're my cheats.
They're your cheats, and you're
other people would be like, that's healthy. And I'm like, no, it's not. But yeah. So, but like anything can be healed in anybody, I would say, because the body has we've seen people. I was sharing with you earlier that when my dad was in hospice for 2 years, it was just always amazing because his whole being was in the process of dying, but his wounds would heal, right? Like he would hurt, like scratch himself with his fingernail and that wound would heal. And it's like, it's just the body's so amazing and its propensity to just.
How did you get into this? I mean, taking this on is a daunting task. I mean, I wanted to be a doctor from the time that I was 3, and I don't remember what I wanted to be before that. But how did you come to this line of work, really, this focus and direction?
Well, I actually never wanted to be a doctor. I never wanted to work with people on their health. I wanted to be a mom, first of all, but then when I was younger, I was told I was infertile, so that didn't happen.
Oh.
And then I got really sick myself. So I was doing all the right things that we're told to do. I was slender, I looked good, I exercised, and I had collapsed the idea that if you're slender, you're healthy, or that if you're fit, you're healthy. Those are two completely separate things. And my health started tanking. The first indication was that I was in the Philippines and I had just taken an anti-malarial medication and I couldn't breathe. And it was really hot and humid there. Unfortunately, I was in a home where there was a freezer and I stuck my face in the freezer just so I could get some air. It was very scary. I did not stop taking the medication because I was like, well, it'll get out of my system after it'll flush out of my system. So I was on that for a total of 6 weeks. And I learned later that it would not flush out of my system. It was actually a neurotoxin. And so, yeah, so so it takes a long time, as you would know, to do anything with the nerves. So, I would say it took me about 20 years to get my nervous system back in order, to where I wasn't having the problems that I was having. But one of those problems is breathing. Like I'll be like, can't breathe. I can't breathe. And so if I'm exposed to too many toxins or too much stress, I'll be like, can't breathe. So it kicks in. So I'm not different than anybody else, right? Like I got to manage myself. And as long as I'm managing myself, things work really, really well.
Is one of your cheats to use an inhaler like a beta agonist? I would be
I don't
inclined
need
to.
an inhaler. Yeah, I don't, it's nothing to do with my lungs. So I did try using an inhaler once when I was trying to figure it out, and it didn't do anything. It made it worse. So it was like all it is like my muscles and my ribs clench up.
Hmm. Hmm.
So I get a lot of musculoskeletal stuff. I get a pain in my back if I've had too many toxins.
Wow. It's nice that you have some way to measure it, that you have developed that over the course of years.
Yes, yes. And most of my patients, when I'm working with them, they will get to a point where, because I ask people to reflect, I ask my patients to reflect on what's happening so they can cue in. And the ones who are really paying attention, we can walk up to a buffet and look at the food and know what's going to make us feel good and what's going to make us feel bad.
Without muscle testing, I've heard
without muscle testing. Yeah, without muscle testing, you just know you get in when you get back in communication with your body, you can tell if a medicine is going to make you feel better or feel worse. You feel what that is, and it's great to have that.
Wow.
Yeah.
Gosh, so your receiver is becomes set to the frequency, almost the vibrational quality of those things in your environment, and you can sense what might be a danger to your organism.
Yes, exactly. And we
Wow.
all have that ability and that capability. We've just lost it. We refer to we ask other people.
Yes.
Right.
Yes.
Yeah. What are your thoughts on what I've said?
Well, I'm very interested. I personally have been, I don't know, experiencing a dissatisfaction with the disease model in allopathic medicine. I've been wanting something more for my patients that come to see me and want a pill to fix it. You know, the magic is in the pill. And I just haven't known what that might be.
Yeah. Yeah. The challenge with people who are in the medical mindset, which is the majority of people, is that, yeah, there's a magic pill. I just have to take a pill and I really don't have to do much else, maybe a little. That will just keep them sick. And you have to want it. And it's you can do the healthy eating and learn a lot and start recovering your health. But to get really healthy, you really need to feed your organs what they need to be healthy. And that starts getting expensive too. So I would say that anybody can start turning their health around by eating the right things. And like I said, most people don't know what that is. I did write a book called Vim and Vigor, Escape the Medical Merry-Go-Round, Reclaim Your Health and Live a Long and Healthy Life. That book has all the information in it that you would need to start recovering your health. And so for the price of a book, you can start figuring out what to do. It's actually all in there, everything you need to know. And I do have a course to help walk people through the whole process. A support group on Facebook. So we're starting a support group for people, an accountability program for people who are like, you know what, I'm tired of this medical model. I want something else. I know that I should be healthy. So, yeah.
Well, it's very impressive, Dr. Juul. I'm really happy we had this time together. But
well, I think you'd be able to help a lot of people with this type of care as well, especially with what you know about the brain, the neuroscience, because you have a specialization in neuroscience, right?
Yes, I do. I've studied that psychiatry. I was trained in general and in child and adolescent psychiatry. The kids, the tiny ones, the 6-year-olds that their moms often come to me and say, do something, give this child a medicine. It's too hyperactive. It's irritable. It screams all the time. It doesn't listen.
Yeah.
Behavioral
A lot of times
problems.
and a lot of times that's the diet. And that's the other challenge, is that parents have to eat the same thing that their kids eat.
Yeah. The parents have always been the problem for me.
Yeah, exactly. Yeah, because you could tell the kid to eat something, but they're going to eat what one step at a time, one person at a time. And I believe that we can turn the health of our world around. We're on a sinking ship right now for health. And it's going to take each one of us individually making the changes that are hard at first, but that does become easier. But making those changes, because it's not just for my health, it's for everyone's health.
Right. Well, I'm excited you're here and doing this work. I can't wait to read the book. I want to move the camera so that when I'm looking at you, I'm looking at the camera. I think that'd be better.
Well, we'll have to have a conversation again, because this was really fun.
Yes, I'd like that very much. And thank you for your time, and good luck to you in the pursuit of this program and getting it launched and getting folks excited about it. I know I am. So I'll be.
Yeah, I'm excited to hear about your journey through the program. And are you writing a blog? Are you doing the blogging on it? Oh, I'm excited to see that. I'm excited to see that. Oh, that's great. That's exciting. So yeah. All right. Well, it was so good to talk to you.
You too. I look forward to our next meeting. All right.
Yeah, too. Okay. Bye.
Bye.